when we came up with the idea, it was like saying, well, look, we're not only giving free healthcare, what the governor has promised, he's delivering, but he's delivering more. He's making healthcare accessible to many people who would never get it before. But of course, it can't be endless. But what we're going to be doing is also encouraging people to have a health savings account. And that means that if you have extra, you can put the money in your health savings account. And once you put it in the account, we keep it for you. It doesn't go anywhere. It's just there. Should you ever need to have an unexpected health expenditure, then that can be immediately put towards that. Not only that, anybody having treatment that they have to pay for under the Araya scheme, we call it our scheme Araya, anybody having treatment under that scheme, it will always be cheaper than if you just were admitted and had to be charged without being a member of the scheme. So it will still be more affordable for you. And as time goes on, we've just launched it. There are going to be many, many embellishments, enhancements. So for example, you might be able to do an enhanced package where you are covered for some more expensive things if you pay a little bit more per month. But initially we have to it's very complex. It requires a lot of sophisticated administration. So we want to make sure we've got the basics right before we start getting into the more. You saw probably quite an impressive facility, but it's actually the smallest, and that one has been completed. We've unfortunately not got as far as we wanted with the others, but there are 9 others being done across the state from, in all 3 senatorial districts. In fact, it's off camera, but you can see a pile of architectural drawings sitting there in the corner. Those are all the drawings for all those hospitals. So we've gone as far as all the architectural drawings, the mechanical and electricals. We've even selected the contractors. So in the next, I would say at least 1 month, we would have started work on at least the next 3 or 4. And then shortly after that, it's going to be phased in. So I would say over the next year and a half. We're behind schedule on that one, but we want to get it right. And also, one of the reasons we've delayed is that we realized that it would be best to spend some money fixing up some problems that we have in the existing hospitals rather than starting immediately on those. Some of these things are planned because you have a particular expectation of revenue, and if that revenue doesn't come, then you have to slow down your plan. But it's all on course, and within a year and a half, we'll have to be the proud owners of some new facilities. As well, the same project involves upgrading existing facilities even further. And in fact, one of those projects is being done within an existing hospital because there's so much space in that hospital. It's virtually building like a new hospital within the existing hospital grounds. So we'll have some interesting structures going up, but they're not completed. Totoro, but you can see Totoro, that one's completed. It's even equipped, and we're working on the recruitment right now. The governor wants services, healthcare services delivered. So it's all about what do we need to put in here to make sure more people can access healthcare. So if it needs water, if it needs a borehole, if it needs a generator, more staff, equipment, you put it in there to make it happen. The state is enormous, and we'll keep going at this rate for, I'm sure the next 4 years we'll still need the same amount of attention done, but more and more people will feel the impact. Going back to the Araya program, the other thing that one does is every facility has a monthly, what we call capitation. So the scheme pays each facility. If you are working in a facility and you are registering 1,000 patients, so you have 1,000 patients on your list, then you get 300 naira per patient, even if none of them come through your front door. So that's for your facility, guaranteed. For 1,000 patients, you get 300,000 naira per month. So that immediately means, whereas before it was a trickle, and then every now and then there'll be a lot of attention, and then nothing for a while, because it's all centrally directed. Now, it is the money following the patient. If you have 1,001 patients, you get 300 1,300 naira. So the money increases according to the patients you're looking after. So when you use that money, if the patients are just coming in, maybe 10 a week or something like that, you have money to buy the drugs, you have money to place consumables, you have money to paint, you have money to put a borehole. Every month, the board of trustees will sit down and say, okay, what are we going to do with this month's money? What are the problems, challenges facing? So you have immediate management, you have community management, and they have funding on a predictable, regular basis. So you cannot go there 1 month and go back the next month and you won't see a change. Or 6 months down the line, imagine the change you will see in your little PHC if they have been receiving 300,000 naira per month. And most of these schemes will be registering about 3,000 to 5,000 patients. So imagine the difference that will make. What it does is it makes the money circulate under community control and it stays locally. The government doesn't take the money back. The money remains under the control of the communities. So that mechanism is going to resuscitate primary health care in a very dependable way so that more and more and more services are delivered. And we are also creating what is called a quality unit that goes around and advises the board of trustees that, okay, you've got to this standard now. Your next few bits of money, use it to put in place some more standard operating procedures. Use it to change that machine. That is unsanitary, that arrangement there. Knock it down, do another one, and so on and so forth. So gradually, government will be focusing on just looking at the quality and the services being delivered. So it's not just about ensuring people and they can go to the facility. It's about making sure the facility is supply and demand. The supply side is also being taken care of so that quality improves. Under state control, we have one tertiary institution. There's some 2 federal government institutions here. The Olabisi Onabanjo University Teaching Hospital is the government-run tertiary institution. Like the rest of the health service, it suffered for a while. When we came back in fact, the first year was spent paying off debt. There was some hundreds of millions owed in back salaries. Then we had to get in some urgently needed machines, do some refurbishment to some of the wards. In fact, another ward is just, we've had to move everybody out of the ward and that's just about to be refurbished. So what we're doing there is a mixture of remedial, but also taking it up to the next stage. So we just launched, in fact, the government will launch it, it's functioning now, but we've completely redone on a PPP basis. We've got a brand new set of diagnostic center there, brand new set of machines, CAT scan, X-ray machine, ultrasound machine, mammography machine, fluoroscopy machine. If you go into the diagnostic center now, you won't recognize the place. All beautiful new machines, well-trained staff, and it's completely turned around. So again, governor has been investing money to bring the place back to where it used to be. It's unfortunate that so much money has had to go into things like cracks in the wall, unsafe buildings, where all you do is you just render it back to safe use. It's not. You can't really clap for yourself that you did it, but at the same time, money went in, and it meant that money that maybe could have been used to take it to the next stage. But nevertheless, if you go there now, you see very visible changes. The health of the state, we are just compiling, I wish I had the latest statistics. We have traditionally not been good at statistics, but we are trying to get statistical indicators of how well we're doing. For example, if I give you an example of something that definitely makes a difference, one of the biggest impacts in health is immunization. We know that I think we were one of the best we've become one of the best in the nation in terms of our immunization percentage. We used to be around the 70%, 76% mark at the time we came in. We've taken that to over 100%. People always wonder, what do you mean over 100%? Well, the population is always changing. So by the time you immunize people, the number of people you thought you had there is increased. So you will always be immunizing. After you get a certain level, you will be immunizing more than the population, the denominator you're using. So we've gone to over 100%, one of the best in the nation in immunization. Now, clearly that's going to impact the health of all those kids who will not be getting measles or polio or other childhood killer diseases. If we go to HIV/AIDS, we've now got prevention of mother-to-child transmission of HIV in every single local government. We only had it in about 2/3 a while back, so that's another indicator. So everywhere you look where we are measuring things, everything is improving, and when we get our latest statistics in, then we'll be able to show, for example, that maternal mortality and infant mortality is dropping. We're fully confident about that. And of course, by the time the community health insurance scheme really kicks in, I think you'll see astronomical changes. So we're on course for most of the MDGs.
Welcome back. In tackling the issues, the state government is working with findings from a survey it carried out at the beginning of this administration for a total revamp of the state health sector. With this, it hopes to have about 600 comprehensive primary health centers across the state. So look out for one in your area.
And on that note, we draw the curtains on this week's edition of the program. Hope you enjoyed it.
Do join us again same time next week for another episode of the program, as we take you through another sector where the state government is rebuilding the state using the Ogun standard. Thanks for watching, and bye for now.